It's understandable, right? I mean, children get, in the first few years of life, will get vaccines to prevent 14 different diseases, which can mean as many as 27 inoculations to prevent diseases most people don't see, using biological fluids most people don't understand. That there's pushback on vaccines makes perfect sense. I get it.
Honestly, I get it too. I wanted to cut through the noise. So I called a friend of the channel, Dr. Paul Offit, who's a world-renowned pediatrician specializing in infectious diseases, vaccines, immunology, and virology. But he's not just a medical expert. He's also a member of the FDA Vaccines Advisory Committee, a celebrated author, and a co-creator of the Rototech vaccine, which has helped save the lives of hundreds of children every day. Given Dr. Offit's commitment to making the world a healthier place, I was really excited to set the record straight on why China was actually responsible for COVID, the vaccine approval process, and I ended up even giving him my 2 cents on the value of transparency in medical communication. Pleasure having you back.
Thank you.
Very excited to talk about the idea of innovation in healthcare and how innovation comes with its own challenges. And something that I've been seeing in the health space, especially when it comes to the health media space, is whenever there's a breakthrough, now people are talking about it earlier than ever before, meaning earlier in its stages of development. What are the risks of getting too excited about new technology?
Right. Well, I mean, it used to be that there were, in terms of the number of journal articles that were published per day internationally, it was about 4,000 journal articles a day. That has doubled in the time of COVID. And also there are many more preprints that are published. People will even reference preprints, meaning non-peer-reviewed preprints. I'm waiting for people to reference, something I heard on the bus on the way to work.
They are saying that.
Right. So there's sort of a little bit of a loss, I think, in terms of the degree to which there is oversight of that kind of information. So you're right, and we're very quick to jump to the next magical, mystical thing that's going to make everything better, not realizing that all these innovations, historically, every single one of them have been associated with some human price. There's always a human price to pay for knowledge, always, and I don't think we accept that. We think we're so far along now in the world of science and medicine that that learning curve is finished, and it's never finished.
What is that human price that we have to pay for innovation?
That there were adverse events that followed something, whether it was vaccines or whether it was blood transfusions or whether it was chemotherapy, whatever it was that you didn't know about. And so I think if you ask people, do you think we're going to know more about science or medicine 10 years from now, 15 years from now, 20 years from now than we know now, everybody would say yes. But when it comes to their disease or most recently our pandemic, they want you to believe you know everything right now when you don't, because you never do.
Yeah. Like thinking about innovation right now, people's minds go to AI, CRISPR gene editing. Where do you think those scenarios play out in our lifetimes?
Right. What worries me there is that it's scientific innovation without conscience. I mean, without necessarily an overarching ethical, moral conscience, which is historically true of scientists. I mean, scientists will see sort of science uber alles, and they don't necessarily see the bigger picture. I mean, if you look at people like William Shockley, who invented the transistor, or James Watson, who was with Francis Crick and Rosalind Franklin, and Maurice Wilkins figured out the structure of DNA. They saw that as the cure-all. That we could with eugenics and sterilization, that we could make for a better population because they just saw science as the cure for everything, not realizing that there are ethical and moral problems with that kind of style. But you see it now. I mean, you see it now with our politics. I mean, the notion that people are coming to this country with bad genes. So that still hasn't gone away. This notion of sort of the genetics of intelligence still hasn't gone away, which is frightening.
Yeah. What have you seen on the CRISPR front? I know, for example, in Asia, there were some scientists that were sort of held in high regard that started experimenting with CRISPR in non-lethal conditions, potentially experimenting on young babies and trying to rid them of the ability to get HIV. And the world that is in the CRISPR space, the community was very upset about it because they said you're experimenting genetically, not knowing how this is going to impact the rest of the child's life for a condition that was not life-threatening to them. Is that sort of the quandary you're discussing in the book?
Right. Exactly right. I mean, so there's an HIV researcher at the University of Penn named Jim Hoxie, who, as it turns out, doesn't have the HIV binding receptor. Good news for him. And so could you genetically engineer children so that they don't have that binding receptor? Yes, you could. I mean, it's interesting that, again, to go back to James Watson, when he was asked about gene editing, he's still alive, actually, he's like 96 years old, he said, we could make girls prettier. And what's wrong with that? See, this is why you don't want scientists weighing in on this stuff.
It's funny. It reminds me of listening to the difference of researchers speaking on advice to people versus clinicians speaking on advice to people, and how different that sounds. Because these days, the people who are doing some research, or at least evaluating the research, present the data as if it's done. Like they've reached some sort of utopia and they said, this is what we know. This is the hard end. Now we know cold plunges will extend life. We know that if you take rapamycin, you will live longer. And yet, despite knowing the research, they don't understand how that information is landing to the general public from a clinician standpoint. Do you ever see that play out?
Yeah, for sure. I'll give you a personal story. I mean, I was fortunate enough to be part of a team at Children's Hospital of Philadelphia that created the strains that became the rotavirus vaccine Rotatech. So it's sort of like, when the gods are angry, this is the old Chinese proverb that when the gods are angry, they grant you your wish. I mean, so we were working for 25 plus years on trying to make a vaccine to prevent this disease, which can causes roughly 2,000 children